Two things. One, I think it is just a willingness to have those conversations. I think coming from a Middle Eastern cultural background, mental health isn't commonly talked about, and I think that is it's common in many different cultures where it's more if there's something with mental health going on, it's more, you could tie it back and harken it back to like a religious background, and maybe you should pray more about it and things like that. And there's definitely a role potentially that faith could play in this, but I think from looking at ADHD as a neurobiological condition, it's also important that you address it with interventions that are appropriate for the severity and the type of symptomology. Um, and so I think being able to have those conversations, the other thing that I think is wildly helpful is that for people that do have ADHD, normalizing the conversation and normalizing the condition, and recognizing that you can have ADHD and you can accomplish things appropriately with having ADHD. It's just a matter of understanding how your own neurobiology in order to achieve those milestones. And so I think that's part of what my advocacy has been online, is talking about my own journey with ADHD and how I got involved in that, and how I'm using that personal background to hopefully help others that are kind of in that stuck position in diagnosis or evaluation or treatment.